Hello, attendees. Thank you so much for attending our conference. And if someone could turn down over there so that I'm not here, thank you. So I just wanted to say, this is our sponsor spotlight section. We will be having one before each speaker. And what I wanted to make sure was that everyone here had a direct point of contact for each of our sponsors. I think that it's important that we have a person that we can reach out to if you are someone who is interested in their programs, wants to learn more, or needs use of their services. I think it's important that we all have one. Also, I just wanted to remind everyone that CEUs will be sent out after, like during the Q&A of every speaker presentation. So please check the chat box. You will click the link. It will take you to a brief survey. Please fill that survey out for us. One of the most important things is to hear what you all would like to hear about at the next conference. We really want your input. We want your to know what you all want. And so it will not be posted after those speakers. So if you are here for that speaker, please make sure that you know that those speakers will be, that those CEUs will be posted in the chat box after every speaker presentation, and it will not be posted again. So if you're not here for that presentation, we cannot give you a CEU for it. And we will be reminding everyone of that throughout the day. Just make sure to check the chat box during the Q&A. If you have any questions that you would like to ask of these speakers, we ask that you write those in the Q&A section. And like I said, I wanted for everyone to have a direct point of contact for each of these sponsors. And we are going to start with the SOAR program. The SOAR program is not only a sponsor of ours, but they are one of our community partners, and they are an asset to everything that we do. Are you or someone that you know struggling with opioid use or opioid dependence? New resources are now available, ensuring that the most effective treatments for opioid disorders are accessible to those seeking help. Medication-assisted treatment, or MAT, has proven to be the real avenue of hope for people abusing opiates. The SOR program provides specific assistance to uninsured individuals who otherwise would not have access to MAT or the necessary wraparound services needed for success. Please contact one of our recovery pathfinders immediately to determine eligibility. The contact for the SOAR program that I've got on the screen is Chris Moore. There's his phone number, his email, and the SOAR website. Like I said, they are an asset to us. We could not do what we do without Chris and his team. They are able to get many of our clients into treatment and onto medication-assisted treatment. We couldn't do what we do without them. So we're really thankful for you all. And now we're going to hear a word from our next sponsor, the Shelby County Health Department. We strive to become the healthiest and safest community in the country. The Shelby County Health Department's mission is to improve, promote, and protect the health and environment of all its residents and visitors. We really appreciate the Shelby County Health Department and their support. They have been huge supporters of ours, and we also consider them a huge asset in the community and a community partner as well. Our next speaker, Tunishia Kuykindall, is sponsored by the Shelby County Health Department, and I'm going to turn it back over to Olivia to introduce her.
Hi, everyone. Just a quick reminder that the CEU for the next presenter will be in the chat box during the Q&A section. And if you have any questions, please post your questions in the question and answer section. So our second speaker of the day is Miss Tunishia Kuykindall. She is a graduate of Walden University, Tennessee State University, and Nashville State Community College with degrees in clinical research, administration, biology, and biotechnology. She began her career in the private sector as an environmental specialist, testing factory wastewater to reduce pollution from factories throughout the United States, and transitioned her career to public health in the fields of environmental science, health, and education. She now continues her 11-year career in population health and education as the Fetal and Infant Mortality Review Team Leader with the Shelby County, Tennessee Health Division. She has also made contributions to several published works. She is passionate about education and empowering the world about obtaining and maintaining healthier lives.
Thank you so much, Olivia, for that introduction. And trying to find my window, right? Okay, excuse me. So thank you again for having us here today. I'm Tunishia Kuykindall again from the Shelby County Health Department's Fetal and Infant Mortality Review Program. Our objectives today are to bring awareness of fetal and infant deaths related to opioid use in pregnancy, to show data on the increase of opioid use in pregnancy, to show data on the increase of fetal and infant deaths and how pregnancy-related opioid use has contributed to that increase, and to give suggestions on prevention. So who are we and what do we do? The Fetal and Infant Mortality Review Program works with the community to reduce infant deaths. One of our biggest campaigns is our Safe Sleep campaign, where we give free cribs for babies. It doesn't matter their family income. If they don't have a crib, they can get one from us or any of our partners throughout Shelby County. And we're not the only one to do this. FEMA is a national program, and they all do similar work. We also provide grief support for families and a chance for them to tell their side of the story before, during, and after pregnancy. Let's see. So, infant mortality rates. Between 2017 and 2019, 372 infants passed away before reaching their first birthday. These are just infant deaths, so babies that were born alive, not the babies that weren't born yet or fetal deaths. During 2019, in the US, the rate was 5.6 per 1,000 live births. In 2019, the same year in Tennessee, that rate was 7.1, and in Shelby County, that rate was 9.8. So we know that we have a lot of work to do. Our rate in Shelby County is higher than the national rate, but any baby's death is not a good sign. So because this is the Alcohol, Tobacco, and Other Drugs Conference, we wanted to highlight different things in pregnancy, including alcohol. So there is no known safe amount of alcohol at all for any part of pregnancy. We've had cases where women have said, oh, I did drink wine or I had one beer, but there's no amount of alcohol that is safe according to the CDC. And they showed us rates of women and alcohol use. These aren't necessarily pregnant women, but they're women of reproductive age. And it shows across the country the prevalence of alcohol use. So tobacco in pregnancy. Pregnancy risks for fetuses and newborns are included in tobacco. On the death certificates that we review, they always ask if tobacco was a factor because it has so many risks. So for fetuses, it's delayed growth, higher chance for babies to be born too early, permanent brain and lung damage, and higher risk for stillbirth. Risks for newborns include them being born at a smaller size, to have colic or uncontrollable crying, SIDS, sudden infant death syndrome, which is one of the things we truly try to stop with giving the free cribs, and also development of obesity and asthma during childhood. So now let's do our main topic, opioid use in pregnancy. So according to Co et al. 2019, they surveyed 34 US jurisdictions to find how many people were using opioids during pregnancy. In their study of more than 20,000 women, about 1,400 of the women reported using opioids in pregnancy. Among those people, more than 21% reported misuse. So they weren't just using it for pain, and they were using too many. Also, 27% said they really wanted to cut down or stop using the opioids, but they didn't feel that they could at the time. These women were actually being prescribed opioids during pregnancy. So there was a doctor writing the prescription and a pharmacist filling the prescription for the pregnant woman. And 68% said that they did receive counseling from their provider on the effects of opioids during their pregnancy. So these tables are still according to the research of the 34 US jurisdictions in 2019. The highest group that was using opioids was between 25 to 34. So still within that ideal pregnancy range. And the race with the highest pregnancy opioid use were white non-Hispanic women, according to this survey. Almost 10,000 of the respondents, or almost half of the respondents, were white non-Hispanic women. So more demographics that showed opioid use in pregnancy. Most of the women were on Medicaid insurance. They also had more than one child. And most of them, more than 19,000 of the 20,000 respondents did not smoke during the last 3 months of their pregnancy, but they did use opioids, most of them. So where were the prescriptions coming from? They were coming mostly from their OBGYN, midwife, or another prenatal care provider. And some of the reasons why moms were using the opioids, from what they stated, was relief from pain that they sustained during pregnancy. So injury, condition, or a type of surgery while they were pregnant. There were other reasons other than pain. 204 respondents said that they took it for other reasons, which included to relieve their stress, to help with their emotions, to help them sleep, or to feel good or get high. Some of the parents, again, or future parents, did also say that they felt like they were hooked, that they had to use the drugs. And there were other misuses, non-healthcare provider sources, or reasons other than pain. So we know as people who study opioids that some people don't need a prescription to get it. So there were respondents who said that they got it from other sources. So opioid use in pregnancy, according to the CDC, opioid use in pregnancy is linked to stillbirth and birth defects. The number of women with opioid-related diagnosis documented at delivery increased greater than 100-fold, 131% increase between 2010 and 2017. Our local FEMA team has seen an increase in alcohol, tobacco, and other drug use in our fetal and infant death cases. In a recent case that resulted from, with a preterm stillbirth was a mama who was non-compliant to prenatal care after testing positive. Even with the other drugs other than opioids, a lot of times if mom tests positive, we see a great decrease in her prenatal care that she just stops going. After delivery of this case of a mom, she actually obtained some opioids and other drugs while she was in the hospital. The father of her child gave her the drugs after she experienced the stillborn birth. The hospital staff did counsel mom about her drug use, including telling her straight up that she could die before leaving the hospital. And they offered other treatment options. They went back and forth. They said they were really negotiating with mom to convince her to stop the drugs, which could be hard for mom if she's addicted to them. The same counseling that mom received in the alternative drugs, if it was provided earlier, mom may have had a better outcome with her child. So causes of infant mortality. Almost 21,000 infants died in the US in 2018. The 5 leading causes of death were birth defects, preterm birth and low birth weight, injuries, sudden infant death syndrome, where they sometimes didn't know why the baby died that appeared healthy before, and maternal pregnancy complications. So just as opioids can increase birth defects and preterm births, those numbers were the leading causes, number 1 and number 2. So stop event response. When hosting street team for overdose prevention events or stop events, public health outreach workers have rarely seen pregnant women coming to receive care. If they have seen them, they maybe see them once and never again. The public health outreach workers are creating new ways to encourage pregnant women to seek help to receive addiction treatment without stigma. Opioid maintenance during pregnancy. So there are treatments for mothers with opioid use disorder. So those who are misusing opioids. Improved screening for opioid misuse and treatment of opioid use disorder in pregnant patients might prevent adverse outcomes. The CDC recommends that pregnant women be encouraged to start treatment with methadone or other drugs, but not naloxone. So in summary, there has been an increase in fetal and infant death cases where the mother was positive for alcohol, tobacco, or other drugs, including opioids, and was a major cause of pregnancy complications and fetal deaths in Shelby County, Tennessee. Many of the mothers received little to no prenatal care after testing positive for substances at a prenatal visit. We can reduce the chances of continued substance use by destigmatizing, treating, and counseling women and families before, during, and after pregnancy. Thank you so much for listening to our most recent findings. And are there any questions or any answers, anything that someone else wants to share that knows about the topic as well? Or I don't know, Scarlett, if you want to have it at the end. And I can go further while they're getting the sound together. This is our FEMA team. So we don't work by ourselves in this fight. It's not just me presenting to people in our community, but we have a team of people including the other programs of the health department that work closely together to reduce infant deaths. And there are sources available if needed, most of them from the CDC, and additional sources with flyers, opioid pain fact sheets to help providers.
Thank you so much, Tunishia. So we have all the questions up. Are you ready?
Yes.
Perfect. Cool. So I'll just go ahead and get started. So our first question is, what can be done to stop prescribing opioid prescriptions to pregnant women?
And for the short answer, for doctors and pharmacists to not prescribe them. There are alternatives to pain medication. As in our case, the staff really worked with them to find a drug pain relief alternative that was safe during pregnancy. So just remembering that that opioids carry a very high risk, especially a risk of death to the babies. Maybe pharmacists having a flag that says this person is pregnant. I know that a lot of moms, they have to ask, okay, I'm breastfeeding, should I take this medication? Or it's written in the document or in the paperwork that comes with medications. But if there was a flag that went up for multiple levels, from the doctor to the pharmacist to say, this person is pregnant, maybe they should take an alternative drug if possible. And also, if they're already taking opioids before they get pregnant or before they go to their first prenatal visit, to offer them help to get off of the opioids and onto a lesser medication. Also with opioids, it's written that you're not supposed to immediately stop them because they can cause more damage than actually taking them regularly. So a doctor would have to help a person wean off of the opioids. So the sooner, the better.
Yeah. So I guess kind of just going off of that, are there free resource treatments available for pregnant women who are on opioids?
I haven't seen any. The closest I would say is we do have insurance. It's called presumptive prenatal insurance through the Shelby County Health Department. They help women sign up for insurance that may not already have it. And with insurance, they can get help.
Cool. Perfect. So the next one is how are we reducing mothers who are pregnant for alcohol abuse? What is the company actually doing?
Someone just threw in the chat, one of our partners, Baby Love. It's a shelter type resource program for women who have addiction, and they help them. So I don't know who that was, but thank you for putting that in the chat. And that's a resource that's in the community. They have social workers at hospitals that can help doctors know what's available. They have counseling sessions. So with our case that we presented, it wasn't really the doctors talking with the family to negotiate what drugs she could use. It was the medical social worker who was trying to understand that family situation, not stigmatize them by saying, okay, you just lost your baby and you're still doing the same drugs. They really talked with them and understood that, yes, this is something that you're intaking. We know that it can be addictive. We're trying to help you. Oh, Scarlett, you're muted.
Sorry, just kind of going off that again. Are there any other programs that provide women with basic needs for babies like clothing, formula, car seats?
Yes. So our WIC program provides them with food. So food for mom while she's pregnant. And when she has the baby, I believe the program goes up to age 5. So there's formula available. Even when there was a recall on Similac, there was an alternative formula available. So that's one for food. We, in the FEMA program, not only do we provide cribs, but we provide diapers as well through Mid-South Food Bank. And Mid-South Food Bank is partnering with lots of organizations, including some schools in the county. I know Loran's elementary and middle school just partnered with them as their pilot school. And there was one more, car seats. So we actually fund part of the car seats for the car seat program, presumptive eligibility that works with the insurance. They're also the ones who do the car seat program. Car seats are available on Tuesdays and Thursdays. They show a video, they teach them how to use it, and there are events across the county, different health fairs, where they actually help people install it into their cars. Not only us at the health department, but police departments do the same thing as well. So even if there's a traffic stop, they try to get them a car seat if they don't have one, instead of just giving them a ticket, and they actually help them install the car seats.
Perfect. Cool. Thank you so much for that. So another question is, why do you think mothers aren't receiving proper prenatal care?
So one of the things we noticed and what we've seen before is there was a law that if a mother tested positive, there would be consequences. So the consequences range from mom going to jail or the baby being taken away as soon as the baby was born. So it was a reporting thing. I don't know if that law is still in effect, but what we have seen is when we look at prenatal records and we see that they tested positive, they don't come back until they have the baby. And a lot of times they have that baby early.
So another one is, if a woman discloses to her doctor or nurse that she is using opioids while pregnant, will that be reported to authorities / will she face any kind of charges?
Yeah, we don't know that as FEMA at this time. We knew it was a law previously, but haven't seen any changes or information about that law. And let's see, I see more. Oh, I think you're reading the chat of the questions. But yes, we don't know exactly what law enforcement is doing or how reporting is for that. The only thing we know has to be reported is if they have a contagious disease, that they have to report that to the health department.
So kind of going off of that, I know at one point women had a fear of being incarcerated if testing positive during pregnancy. Do you feel this is a factor for women not seeking prenatal care while using?
That's our thought, because we started seeing that trend right around that time. Here and also in hospitals in Nashville, Meharry Hospital. I also worked in a lab, and we would get the results, but we, at that time, in the early thousands, we weren't told that we had to report it. But I do know after moving to Shelby County that that was a law before. Again, we don't know if it's still in effect, but memories are great. If you know before that something was happening, they don't always publicize changes to the law. So people may still have that in the back of their mind.
Yeah, absolutely. So do you know if there's any process, or if there is a process, what is it if a baby tests positive for drugs when born?
So the biggest process is getting healthcare treatment for that baby. Someone did say you have to report to DCS. And as a public health worker, if we go into a home, which we haven't done for years now, well, a couple of years, if we see something, we had to report it. So we do report to the Department of Children's Services. The step that Department of Children's Services takes is to try to get that family help. They're not there to take the child out of the home, but to get that family help, because they know the first thing they try to do is keep the family together if possible. But in the hospital, if the baby does have what they call neonatal abstinence syndrome or syndromes related to drugs, they try their best to help that baby wean off of those drugs and to get counseling and help for the family.
So could you explain CAT and CRT a little bit more?
Yes, so the CRT is the case review team. We get recommendations from hospitals or notifications of a fetal or infant death. And from there, we try to find all the information surrounding that death, and we review those cases with our case review team. That team tells us, and it's a group of them, usually about 20 people per month meet, and they say whether or not the case was preventable or not, or if they don't know, because sometimes we don't have all the information. With that team, the only types of cases we don't review are homicides. We leave that for the child death review team, which reviews deaths of all children, anyone under 19. So with the case review team, after they review the cases, they send that, we send the information to our community action team. So that action team takes the recommendations from the CRT, the case review team, and they put those into action. One of the biggest things we're doing now is what's called health equity modules for providers. Those are almost completed and due to pilot in June, where they saw from the family interviews that a lot of families didn't feel like they were being heard. They didn't feel like, one, their pain was being managed in any way. They didn't feel like their doctor took them seriously when they said they thought something was wrong. And it was so much so that a lot of families, they wouldn't go to the hospital where their doctor had privileges. They would go to either the closest hospital or another hospital where they thought they could get better care. So with the physician modules, which is a CAT project this year, we want to encourage physicians to really listen to the patients and understand that in Shelby County, it's a melting pot. There are a lot of different types of people. And even if they're part of one particular race, it doesn't mean that they're going to react the same way to everything.
So following that, would you also talk a little bit about CHANT too?
Yes, so CHANT is the home visitation program that we work closely with. They help families with pretty much anything. They start with women who are prenatal through, some of the programs go through 21 within CHANT. It used to be a program called Children's Special Services. So they work closely with the families to get them all the care that they need. CHANT stands for Community Health Access and Navigation in Tennessee, but not only health navigation, there's so many things linked to health. The education that you have, the job that you have, the place that you live, and the food that you eat. So anything related to helping that family, they help them.
Perfect. Kind of going off of that, what approaches are used to get this information out there to pregnant women? Because I know it seems like a lot of the community doesn't know that these exist out there.
Yes, so we really do a lot of advertising. This past year, we did a really big push campaign for cribs because so many of the deaths, they were co-sleeping. And one of the things we wanted them to know is, okay, not only do babies need to sleep alone on their back and in their own crib, but we have cribs to help you do that. We know that there are other factors that contribute to co-sleeping, a fussy baby, or just wanting to feel the baby to be more comfortable. Being a parent, especially a new parent, can be very stressful. So trying to put them in a pack and play and they're crying can be a challenge. So the state of Tennessee is actually working on a different plan to not only educate, but really help parents soothe their babies as well.
Also, kind of going off of that, I know we have stop events pretty much quarterly. Have you noticed if those have made any impact in prenatal care or helping women who already have children?
The only thing that we've been told from the stop event staff is that when they see a pregnant woman, they usually don't see their pregnant woman again. And they're really working on ways to help encourage pregnant women to keep coming, to keep seeking care, and that they won't report that they're using, they just want to help care for them.
And what are some ways the community could get involved in these initiatives, like either on their own or working with the Shelby County Health Department or the coalition?
Well, I see Ella Jones has asked, is there any support for fathers? So yes, we used to just go into the jails and help dads transition back who were about to get out soon with little stations on how to take care of their infants. Now when we give our pack and plays with the diaper bags, we include things for the father, especially a Father Matters t-shirt, just to boost their confidence and let them know that, yes, you do matter. Yes, we're, constantly talking about mom, but even in our interviews, they used to be called maternal interviews. And now they're family interviews because mom isn't the only one who lost a baby. Dad did too. There are also workshops for dads. We work closely with other agencies that just do fatherhood work, including SeedCo. So we're partnering with the people already doing the work because everybody needs help, especially fathers in the family too. And Scarlett, Did I answer your question completely? Was there another part to it?
I guess just the final part was, were there ways like the Shelby County community could get involved?
Yes. One of the big things is if you see someone who or you know someone who's co-sleeping with a baby, or someone who is having complaints about their pregnancy, but they're not sure how to address it with their doctor, just encourage them to say what's on their mind. Go with a mom to her prenatal care if she doesn't have support. If you have a friend or someone that you know, or agencies can possibly link up with families to go with them. I mean, we have CHANT, we have Early Success Coalition in Shelby County, but the home visitors can only do so much. So if our community actually gets more involved with families, if the families want them to help advocate for them, I believe that our rates can go down drastically.
Perfect. Yeah, I agree. And I think that's like a message that needs to get sent out into the community. And I think it just starts by one person at a time. That concludes our Q&A. Thank you, everybody. Thank you so much. Again, to our MOPEP students, please just make sure you're putting your questions in the group chat and the Q&A section. And I will also be putting the CEU link again in the chat. I already put it in there, but I'll put it again. Make sure you are filling that out after every single speaker. And I've just put that in.
All right. Thank you so much, Scarlett. We've got a little bit of extra time on our hands. And so I'm going to introduce one of our communities, representative from one of our community partners. She's from an organization that does so much for this community, and it's so apropos to the presentation that was just shared. Thank you so much, Tunishia Kuykindall, and to the health department. Thank you for that presentation. I'm actually going to ask a friend from LeSue community, who, like I said, is an amazing community partner of ours, and who has tons of resources for women in the community. Let me get her pulled up. This is Whitney Fullerton, and she's going to tell you a little bit about LeSue and what they do over there. Let me get you unmuted, Whitney. All right, this is Whitney Fullerton, and she is from the LeSue community.
Hi, everyone. Thank you for having me. So grateful that I get the opportunity to share about LeSue community. So my name is Whitney Fullerton, and I am the program director here at the LeSue community. Our mission is to provide support and education for women who have survived trauma, addiction, prostitution, and life on the streets. What that looks like is we have a drop-in center right off of Summer Avenue, and we are open on Mondays from 12 to 4. Women can drop in and eat a hot meal. They can take a shower. We have a clothes closet. They can bring their laundry and we will wash it for them. We do arts and crafts on Mondays. We have a local artist who comes in and does crafts with the women. We have a room where women like to take naps after they eat lunch on Mondays. And then the women can make appointments to meet with us on the other days of the week so that we can talk one-on-one and find out other needs that they have and how we might be able to help them. We also do street outreach on Thursday nights, so we will be going out tonight. We go up and down Summer Avenue. That is the area that we currently serve. In the past year, we've served over 100 different women just in a very small area up and down Summer Avenue. We meet new women every single week. And then we have women who we've been serving consistently for the past 3 years. So we go out on Thursday nights and we hand out care bags. They contain travel sized toiletries and snacks, toilet paper, bottled water. And so the other services we provide, we consider ourselves kind of a bridge between the women who are on the streets and other services. So we find out what their needs are. We have no requirements for them to receive services from us. We like to say that we love them where they are, and we're going to love them again tomorrow and again the next day. So we have no requirements, no agendas, no motives. We just build trust and build relationship. We believe in the power of community. And we have found that as we build that trust and that community, then women feel safe enough to ask for additional things that they need. One of the biggest requests that we get is help with getting IDs. It's really difficult for the women we serve to keep up with their IDs. They have nowhere safe to store them. They get stolen, lost, destroyed. So we help them to get IDs. We can help guide them in getting birth certificates. We help women get into detox and drug and alcohol treatment. We hook them up with local resources that can help with mental health issues. So just so many things. We often are asked what our success rate is. And I kind of get a kick out of that because we don't have, like I said, we don't have agendas or motives. We're not trying to save anyone. We don't have really an end goal in mind. So we like to say that success for us is every meal that we serve, every shower that is taken at the drop-in center, every nap that a woman takes on the couch on a Monday, every ID that a woman gets, things like that. Those are considered success for us. Another program that we have is called All the Women, and it is where we open our clothes closet to women from other organizations in the community. So if a woman, a lot of times they'll be coming straight from jail or the streets and entering, say, a residential treatment program, and they only have the clothes that are on their backs. So that organization can connect with us and set up an appointment, and then bring that client over, and she can go shopping in our clothes closet and get some outfits to help her on her journey. So that has been a really helpful thing, and it helps us to use extra resources that we receive and spread them throughout the community. Last year, we got a donation of 6,000 pairs of period underwear, and we were able to share that with about 10 organizations in town that serve women. So that was really wonderful. Our website, for those that are asking, and I'm not sure how to put it in the chat, but our website is lisieux.org. It's spelled LISIEUX, community.org. We are also on Facebook. We are very active on our Facebook page. every week on Monday evenings after we host the women at the drop-in center, we write an update and post it on Facebook. And then every Thursday evening after we get off of, when we get done doing the street outreach, we write another update and post it on Facebook. And then those two updates are compiled into an email, and we send out a weekly newsletter via email. So if you'd like to sign up for the newsletter, you can do so on our website or on our Facebook page. As far as ways that people can help, we have an Amazon wish list that is updated weekly to reflect our current needs. We put things on there, mainly the things that go into the weekly care bags. Those are the items that we put on the Amazon wish list. We always need volunteers. We are powered by volunteers. We're a very small organization in the sense of employees, but we have a wonderful volunteer base. And we need volunteers Monday through Friday during the day. So you can sign up to be a volunteer on our website, and then I will schedule a volunteer interview and a tour of the drop-in center. We accept clothing donations for women at our drop-in center. Our address is not listed publicly for the drop-in center, but you can find our contact information on our website and reach out, and we will share the address with you so that donations can be dropped off. We accept lightly worn clothing, bags. We use bags all the time. So we pack the care bags into bags that are donated. We take purses, cosmetic bags. We always need cosmetic bags. We pack condoms and tampons and menstrual pads into cosmetic bags and hand those out on the streets. And it gives a little, dignity to hand those items out in something that looks appealing. So reusable shopping bags. We pack the women's clothing that they receive on Mondays into reusable shopping bags like TJ Maxx bags, Marshall's bags. Food, the meals that we serve every Monday, volunteers sign up every week to provide the meal on Mondays, and then they just drop the food off on Monday morning so that when the women begin to arrive at noon, they have a hot meal. So we have a Sign Up Genius, and that is on our website as well. You can click on the Sign Up Genius link and sign up to bring a meal. We serve anywhere from 10 to 30 women every Monday. This past Monday, we had 30 women in a 4-hour period that came through the doors. So we ran out of food halfway through the day and had to figure out a plan B. Thankfully, we had some frozen chicken tenders in the freezer. But we just make it happen. Whatever comes up, it's a lot of fun. And we've seen a few of our women get housing. A couple of our clients are in 2-year treatment programs. We've just seen the value of community so much, especially since opening the drop-in center. We find that the women share resources with each other and they're helpful with each other. So it's been a really wonderful thing, and we're so appreciative of all of everyone in the community and all of the other organizations in Shelby County who are supportive of us. We are so appreciative of that. Does anyone have any questions about our organization? Yeah, that's a great question. How can a provider refer a client there? Some clients do not have a phone or internet access. That is absolutely true. Most of the women we serve do not have phones and they do not have transportation. So a provider can just give us a call. My work cell number is 901-661-5622. Our main number here at the LeSue community is 901-800-8840. So you guys can just call and you can send any client here on a Monday between 12 and 4 o'clock, or we can set up an individual appointment with clients. Once we establish relationships with women and they begin to ask for additional services, if they get linked up with, say, Alliance Healthcare, we do a lot of referrals to Alliance. And so they will go through the intake process. They can come here and use our phone if they need to do a telehealth appointment. Women can also use our address as their mailing address. And we transport women to their doctor's appointments or various appointments that they have. So we find that happens as we establish those relationships. Unfortunately, we are limited to the Summer Avenue area. So like on Mondays, we do pick up women from the streets and we will bring them back here for services, but we just stick to Summer Avenue. The goal is hopefully one day to have a drop-in center in several different areas of town so that more women can be reached. Were there any other? Volunteer hours. So you can sign up, you can fill out a volunteer application through our website. And then you sign up to volunteer through the Sign Up Genius. And I have had volunteers who needed me to sign off on certain volunteer hours, and I can absolutely do that if needed. Let's see.
Thank you so much, Whitney. We really appreciate you sharing your resources with us.
Thank you.
So I just got news in. We've been begging Austin all day. He has agreed to sing and play at lunch, and he has now informed us that Josh Weil from Roxy Blue is going to accompany him. So we're very excited. You definitely want to stick around for this. It's going to be amazing. Two of the best musicians in Memphis are going to play music for us during our lunch break. So get your lunch and come back and enjoy some music during our lunch break. I do, as Anthony was talking about earlier about the coalition, wanted to tell you real quick how you could join the Memphis Area Prevention Coalition. It's as simple as going to memphisprevention.org. and just clicking the join button, and you'll fill out an application. It'll ask you what you're most interested in. You will not receive a confirmation email saying that you are joined. I promise you, once you hit submit, you are. But what you will receive is our monthly newsletter that Scarlett puts out, and it'll tell you about everything that we have going on. And we're very excited that we are now going to be meeting in person again as a community the last Monday of the month at St. John's United Methodist Church at the corner of Bellevue and Peabody. That's 1207 Peabody at 7 p.m. And so if you want to get involved, if you want to make a difference in your community, we have 4 or 5 different task force that you can join. So you'll come to the meeting, we'll tell you all the updates of the coalition, and then we'll break into task force. So we have alcohol, tobacco, prescription drug, stimulant, fundraising, like there's all kind of stuff that you can do to give back to your community. So please join the coalition, let your voice be heard. There's tons of volunteer opportunities. It'll ask you about that on your application when you join the coalition. And throughout the day-to-day, we're going to have the MAPC team tell you about our 4 programs, the Environmental Prevention Program, Tennessee Save a Life, Safe Point, and the Lifeline Peer Project. So throughout the day, we're going to tell you a little bit more about some of these projects. So I hope you're all are enjoying the conference and getting what you came for. And we really appreciate you being here. And now I'm going to turn it back over to Austin Carroll. Thank you.
Hey, everyone, we will be taking a 10-minute break and we will be back here at 11:05 for our next sponsor spotlight. If you all need the agenda for today's summit, please go to memphisprevention.org, go to the summit section and go to ATOD Summit, and you will find a copy of the agenda. It'll tell you about what is in store for the rest of the day. And again, thank you to all of our sponsors. We are so appreciative, and thank you to all of our attendees. We hope that today has been informative.